Osteogenesis imperfecta. Treat the fractures. Observe the frequency.
The first item on the agenda is let's help this child who's got severe pain because a child has a fracture. So whether the child is a 10-month-old child or a 10-year-old child, the pain is pain and it is severe. So that needs to be treated. So the fracture gets treated on its merits. That's the first thing that we all must remember. Then comes the other questions that we asked in between. Is this the first question or the nth fracture? What are the other fractures? Is there any deformity that is there? Is that something that has to be corrected? Can we use this um, fracture situation now as an opportunity to correct any pre-existing deformities? Can we do something today to prevent a deformity occurring tomorrow? So these are questions that are asked as a next step. Then comes the other question of the sort of what I told you, your antennae are up and you're kind of looking around for other potential causes for a child who's coming back repetitively with injuries. That is something, and that has to be handled outside of uh, dealing with the child's fracture itself. Now, as the fracture starts healing, let us say we treat it with a plaster and then the fracture starts healing. Obviously, there is a period of care that is required to make sure that the fracture heals in the position that we've kept it, in the safe position. And that involves counseling the parents, taking care of various requirements for the child. So, for example, if the child has an upper limb fracture, then it is relatively easy to manage the child because the child is still able to sit, stand, walk, and move around depending on the age. Now, if the child has a lower limb fracture, let us say a fracture of the thigh bone, then it becomes so much more challenging for the caregivers of the household. So there is a lot of effort spent there to help them figure out what is the best way to deal with the child with this injury. How do we uh, take care of the child at home? How do we prevent complications with the child being on some degree of bed rest? So, all of these issues are dealt with in the initial few weeks as the fracture starts healing, with monitoring with x rays from time to time to make sure that the position is all right. If surgery is done to deal with the fracture and to keep it well aligned, and that is required, then so be it. And then sometimes we have to hold the fracture in place with devices or implants to hold the fracture in place so that the bone kind of maintains itself in good alignment while it heals. Then, as the appropriate time, exercises for the involved region, exercises for the foot and ankle or knee or the hip joint, or in the upper limb, fingers and hands, so that the child gets back better function. At the end of the whole process of healing, let us say 2 months or 3 months, we want the child to get back to as good function as the child had before the fall. That's a very important thing that we would like the child to achieve.